We've got a great crew here. They're making another fast chair change here on Health This Week, and I'm joined now by Dr. Stan Wasman, also known as the House Call Doctor. Doctor, good to see you again.
My pleasure.
Now, you and I had an interesting conversation, I should say a selection of emails back and forth earlier in the week. There was an article that was published this week in the Boston Globe, and they were talking about your next visit to a doctor could very well be online. And I found that very intriguing. I had to forward it to you and get your input on that.
Well, I love seeing innovation in healthcare. And I find that email communication with patients can be very valuable, especially if I'm ordering lab work or reviewing lab work. You know, it's just a matter of typing it, and it's very easy to express and very easy to record. Now, one area in medicine that's really utilizing this telemedicine is radiology. I work part-time at a facility where we take our x-rays and send the images electronically out miles away, and the radiologist interprets them and sends back a report. Even though he or she is miles away, he's intimately involved in the care.
Well, you know, so much of your appointment with the doctor is spent in getting there, waiting in the waiting room, waiting in the examination room until the doctor has the ability to get in there and talk to you. If you were involved online in a live chat with your physician, and you actually were able to even take your own blood pressure and transmit that data across the internet, I mean, there's a lot of questions and answers and perhaps even some degree of diagnosis that a doctor could make from that information, couldn't he?
That's right. Of course, it's limited. You know, for minor problems that come up, back pain, respiratory infections, I think there's a role. Or for patients who are established, the doctor knows the patient well, and vice versa. For periodically addressing chronic problems, there's definitely a role. But one is limited. Remember, you're losing 3 senses by doing something electronically, and that would be taste, smell, and touch. Now, we don't really rely too much on taste for diagnosis, smell somewhat, but touch is very important.
Very interesting. Once again, Dr. Stan Wasman. Now, he's not doing it online. He's a house call doctor. He comes to you, and his website is schousecalls.com. Stan, thanks so much.
Thank you.